like to call the meeting of the HHS Working Group to order. It's June 8th, 2025, and this is a meeting of the Working Group, so it's not a meeting where we are going to take official action, but we want to have a chance to talk about the bill that we will be taking up tomorrow. I just wanted to first to kind of set the stage. This bill is a very large bill, and as you can see, it involves a large number of people. It is one that we received an overall global agreement target for, but we also have within it, there are 3 sub-targets. And those 3 sub-targets are the health area, and that is the Chair Backer and Chair Bierman and myself. The sub-target children and families, and that is the co-chairs of Chair West and Chair Kotiza-Watoon and myself. And then lastly, we have a sub-target that's made up of items that are kind of crossover items between the Human Services Committee and the Health and Human Services Committee, so Chair Schumacher and Chair Neuer. So we have a large number of chairs involved in this, and that leads me to our to request that what we're planning to do is first we'll go through an overview and a walkthrough of the spreadsheet. And then we will have council go through a summary of provisions that haven't been covered already in the spreadsheet walkthrough. So the focus will be on the policy items or places where additional clarity is needed. And then after that, then we will go to member discussion. And I'm hoping we are planning to finish at 2 o'clock today, so I'd like to make sure that everybody has a chance to be able to say, discuss or give their thoughts about the bill, but that is kind of the time constraint that we're working under. Before we go to the spreadsheet walkthrough, I just wanted to acknowledge and thank all of the staff that are involved in putting together such a large bill. It takes a great deal of effort across many weeks over the session, and especially in the past 2.5 weeks, it really requires a great deal of effort, and it always amazes me the quality and the attention to detail and the work that our staff in the legislature does to support us in creating, in getting these bills brought together. So thank you to nonpartisan staff, the House Research and House Fiscal staff, the Senate Council and Fiscal Analysis staff. We also have a large number of partisan staff, the committee administrators, researchers, and assistants who all played a significant role in trying to and bringing all of the materials together, the coordination of meetings, and just making everything happen. So thank you to all of them for their time and effort, and I appreciate all of the work that's gone into this. And so today we do have before you we have a bill and a spreadsheet. And now I will turn it over to the fiscal staff to begin their presentation of the spreadsheet. And I'm not sure who is starting. Mr. Harney.
Senator Wickland, members of the working group, row 11 of the spreadsheet dated 6/6/2025 at 9:02 a.m. reflects some of Senator Wickland's comments on the combination of sub-targets here. Just note that this bill and spreadsheet balances to the sub-targets, and those numbers are listed in the columns titled FY 26, 27, and FY 2028 and 29. For the sake of brevity, I'm going to skip over the summary information on the first 2 pages and begin the walkthrough on page 3 at the Department of Human Services. And again, for brevity, I'm just going to note items that are included in the working group agreement and their row number. Beginning on line 145, the working group agreement contains the balance of the governor's requested operating adjustment at DHS. Line 155, the working group agreement contains the extension of access to audio-only telehealth services. Line 167, the agreement contains one-time costs related to sustainable funding for federal data sources. Lines 167 contains costs tracked related to the package of proposals for detecting, preventing fraud, waste, and abuse at the Department of Human Services. Turning to page 4, beginning on line 198, there are costs included and tracked on the spreadsheet for new background study disqualifications to address waste, fraud, and abuse. Line 204 is a no-cost item in the agreement for technical updates to the FQHC rate methodology. Line 206 are savings tracked on the spreadsheet related to the drug formulary review committee sunset delay to fiscal year 2029. Line 221 contains the balance of the proposed savings related to the uniform administration of non-emergency medical transportation. Page 5, line 239 tracks cost savings to medical assistants for eliminating chiropractic services for adults in MA. Line 245 are additional savings related to the elimination of the drug effectiveness review project contract. Line 249 are costs tracked for the background studies modifications for federal compliance. Line 253 is a no-cost item allowing for direct payments for adult mental health initiative and traditional healing grants. The balance of the technical changes to the budget structure for select programs is included and tracked on lines 255 through to page 6 on line 268. Line 270 aligns the leadership agreement in the spreadsheet here for the allowable amount of healthcare access fund appropriations used to finance medical assistance. Line 267 contains a balance of select grant cancellations that are tracked in fiscal year 2025. I will not go through them individually, but note that it does not include the reduction on line 280, which is a previous proposal canceling unexpended New American Legal, Social Services, and Long-Term Care Workforce Grant programs. Line 292 is cost tracked in the agreement for MA coverage for birth services provided at home. Line 296 are cost tracked related to the PRTF payment methodology and requirements report. Line 301 includes cost in the spreadsheet in the bill for the Mental Health Collaboration Hub Innovation Pilot Program. Beginning on page 7, line 311, there is additional funding for school-linked behavioral health grants provided in the working group agreement. Line 315 includes costs related to mental health targeted case management rates for individuals aged 18 to 21 years old. Line 320 provides costs that are tracked for the Family Supportive Housing Grant Program. Line 326 is a small cancellation and a new appropriation for PRTF facility renovation grants to Clay County. Line 334 is a grant to Catholic Charities for the Homeless Elders Program. Line 340 is the balance of the Senate proposal for grants to community-based HIV/AIDS support services providers. Turning to page 8, line 344, the agreement contains a one-time dispensing fee directed payment for pharmacies at $4.50. Line 352 tracks the House total House position for the state pharmacy benefit manager for MA and Minnesota Care. Line 364 tracks the Senate position on health insurance plan formulary requirements. Lines 374 contains the House position on MA coverage for traditional health care practices. Turning to page 9 at the top on line 385, the agreement tracks the cost for MA coverage for long-term electrocardiogram monitoring. Line 393 includes savings related to enhanced federal revenue for current expenditures for family planning services. Lines 398 contains savings related to the proposal modifying licensing for specified swing beds. Line 403 contains de minimis cost tracked related to the payment rate modification for phototherapy lights. Line 409 contains the no-cost proposal that the House had for county-administered rural MA. Line 411 contains the balance of the contingent contract with the dental administrator delay. I'll note for members that if you look carefully at lines 417 through 419, the language in the spreadsheet effectuates a change to session law contingent appropriations that were made when this first started in 2021. This proposal uses that money to pay for the balance of the new language. Turning to page 10, line 431, there is a payment modification for birth centers proposal tracked in the agreement. Line 439 tracks the House position on repealing the public option authority in statute and the reduction of the contingent appropriation. That contingent appropriation is sent back to the Healthcare Access Fund where the expenditure was held. Line 443 contains directed MA payments for hospitals and modifications to the hospital surcharge at a 5.75% cap. Line 457 line 457 is not included, so beginning on page 11, rather, line 465 is the balance of the agreement here for MA provider rate increases, directed MCO payments, and the MCO assessment itself. Line 499 contains de minimis cost for systems tracked related to the certified midwifery proposal. Page 12 at the top, beginning on line 503. This is an item that is new in the working group agreement. It contains language and savings related to OTPT limit with prior authorization changes. Line 512 contains one-time cost in the upcoming biennium for Hennepin County IRTS facility. Line 518 contains cost related to the original House position for the tribal encounter rate for housing stabilization. Line 522 is a pre-designed grant for Bridge for Youth. Line 526 is a CPTSD county pilot one-time appropriation. Line 530 is additional funding on top of the base amount at the Department of Human Services for Safe Harbor grants. Same story on line 534, additional funding for the Homeless Youth Act on top of the existing current law-based appropriation. Line 538 tracks the changes that are effectuated in the standalone agreement for the changes to Minnesota Care and the undocumented population. The savings tracked here are the savings related to the capping of enrollment day following enactment of that proposal and the elimination of coverage for adults in the program beginning January 1st, 2026. Page 13, the last item tracked at the Department of Human Services is a proposal changing the definition of gross revenue related to prescription drug rebates, which has the effect of increasing revenue to the Healthcare Access Fund tracked on those lines. Senator Wickland, that concludes my walkthrough. I'm going to now kick it over to Mr. Berg to talk about the DCYF changes track.
Thank you. Mr. Berg.
Senator Wickland, members, picking up on page 13, beginning at line 566 is the Department of Children, Youth, and Families. Included is on line 568 is the operating adjustment for the department. On line 574 is the governor's recommended item for federal compliance, child care assistance program federal compliance. I'll just note that that is primarily federal child care development funds, and a small amount, the second line, is the general fund portion. Line 581 is the governor's recommendation for electronic statewide attendance tracking. Again, I'll note that in the first biennium, that money is in the general fund. In the tails, it's in the federal child care development fund. Moving on to line 588 is the child welfare IT modernization item. This is the SSIS item at $35 million. On line 592 is a cancellation of a previous child welfare IT modernization amount. Moving on to page 14 on line 596 is the governor's rec for increased capacity in the DCYF compliance team. On line 601 is a cancellation and reappropriation of, a partial reappropriation of transition funding for the Department of Children, Youth, and Families. On line 607 is cancellation of funding that was appropriated for the Mille Lacs Band of Ojibwe to join the American Indian Child Welfare Initiative. The tribe has since reconsidered, and this cancels the funding. Line 611 is a reduction in the Restorative Practices Initiative grants. On lines 623 is a no-cost item that makes modifications to ICWA grant reporting and use of special focus grants. On 625 is a no-cost item that expands the public-private permanency collaborative services to include kinship services. On line 627 are modifications to the Teach Scholarship Program. On line 628 are technical changes, no-cost technical changes for DCYF. It says partial because the agreement was to only give transfer authority between the department and Department of Human Services for 9 months. On line 631 is a governor's item to increase or to add funding to the licensing lookup for child care licensing hub. Moving on to page 15, on line 635 is additional funding for regional food banks. On line 641 is additional funding for food shelves. On 645 is additional funding for prepared meals. And 651 is an additional funding for American Indian tribal food sovereignty. Line 655 is an administrative appropriation to administer those food grants. On line 660 is the item for the out-of-school and youth programming assessment. Line 665 is an appropriation to the Child Care Improvement Grant Program. Again, I'll note that $300,000 of that is from the general fund and $450,000 is from the Federal Child Care Development Fund. Moving to page 16 on line 692 is funding for IT related to the Child Care Security Camera Grant Program. Then line 696 is administration related to the Child Care Security Grant language. Line 701 is funding from the Federal Child Care Development Fund for administration related to child care regulatory changes. On line page 16, line 716 is where we refinance basic sliding fee with federal child care development funds to spend federal funding and save money in the general fund. And then the line below that, 722, we do the same thing in the TANF fund. We spend money out of the TANF fund to reduce general fund spending in the Support Services Grant Program to save money in the general fund. And the last item is line 736, where we are reducing the department's base to transfer items back to the Department of Education. There was, when DCYF was split out this year, they realized afterwards that they moved some parts of the base that should not have been moved. This is taking them out of DCYF. At the end of the sheet, when Mr. Vessel gets to it, you'll find an exact same appropriation to the Department of Education. That's the mirror of this item. And Madam Chair, that's the end of DCYF.
Thank you. And now we're moving to Mr. Vessel.
Madam Chair and members, I am going to begin on line 773 on page 17 with the Department of Health. Line 775 is the governor's proposal relating to infectious disease prevention. Line 779 is the MDH operating adjustment. The next 4 lines are all no-cost items. On 785 is the proposal to reauthorize the State Trauma Advisory Council. 787 is converting American Indians Health Special Emphasis grants from competitive grants to a formula distribution. Line 789 is repealing the sunset for the Newborn Hearing Screening Advisory Committee. And 791 is a clarification relating to the Maternal and Child Health Advisory Task Force. Line 793 is the governor's proposal to move around some money relating to cannabis grants. Line 802 is the governor's proposal to reduce some cannabis grants that were ongoing but were actually used for one-time activities. Line 810 is the governor's proposal to reduce emergency preparedness and response stability grants. Line 814 is the governor's proposal to reduce public health infrastructure pilot project grants. And on line 818 at the top of page 19 is a House position relating to reduction of sexual and reproductive health grants. Line 830 is a House position to eliminate funding for alternative health practices. Line 834 is a House provision to reduce funding for environmental health management and administration. Line 838 is a House position to eliminate funding for drug overdose grants. Line 846 is a House position to reduce collaborative funding for state and outside partners. Line 850 is a Senate position, one time relating to reporting for facility fees. Line 854 is a Senate and House position relating to licensing of graduates of foreign medical schools. Line 858 is a Senate proposal relating to speech language pathology assistance fee adjustment. On line 862 is a Senate epilepsy and seizure disorders data collection and state coordination plan. Line 866 is the Senate's grant to the MMA for the Treat Yourself First campaign. Line 871, excuse me, is the Senate's position for a dementia services program. Line 880 is the Senate's position relating to the Healthy Eating Here at Home program. That's a no-cost item. Line 882 is a House position relating to non-opioid directives. Line 886 is a House proposal for grants for opiate antagonists on tribal campuses. Line 890 is a House position on signs of abuse in infants. On page 21, on line 894, is a House position for a grant to change the outcome. Line 898 is a House position to develop and review guidelines for social media mental health warnings. On line 902, this comes from a House position relating to additional funding for Safe Harbor. This next section, beginning on line 906, are all of the Department of Health's various fee increases. I will note that on line 917, that provision relating to aligning the collection schedule of the hospitality fee is not included. Going on to page 22, on line 957 is a Senate and House proposal relating to the spoken language healthcare interpreter work group. On line 966 is a provision that came from the House relating to hot tub licensing requirements. Line 968 is a provision that came up in the working group for additional funding for FQHCs, along with, on the next page, page 23, on line 984 is additional funding for community health clinics. And then on line 990 is I believe it's both a House and Senate position relating to newborn screening and the newborn screening fee. The health-related boards have a number of fee increases and funding requests. You can see them all there and the boards that they go with. I think those are familiar to most members. At the bottom of page 24 on line 1081 is a provision that came up in the working group to transfer $23 million in fiscal year 2026 from the health licensing board's portion of the state government special revenue fund to the general fund. On the next page, page 25, on line 1102 are a variety of positions relating to funding for emergency medical services. If you are interested, you can look for the details on between, I suppose, line 1105 and 1112 to see exactly what the working group settled on. Line 1114 is funding for the Ombudsperson for Families. Line 1118 is the Ombudsperson for American Indian Families. These are all basically the governor's proposals for operating adjustments. Rare Disease Advisory Council on line 1122 with additional funding from the House and Senate. The Ombudsperson for Foster Youth on 1127 with additional funding and an extension of fiscal year 2025 appropriation. And then finally, Mr. Berg mentioned this when going through the Department of Children, Youth and Families. This is the other side of the governor's proposal to move base funding for early childhood literacy grants from DCYF to the Department of Education.
Thank you very much. Members, do you have any questions that you want to pose to the fiscal analyst before we move to the council walkthrough of the language summary? Seeing none, we will move now to the summary, and I just want to reiterate that we're going to focus on the items that were not explicitly stated through the spreadsheet. But if you look at the summary document that is available, it does have all of those sections included if they're something that was on the spreadsheet, so you'll be able to find those in the articles as well. And so we will begin, and I understand, Ms. Heichel, you are going to begin with the first article.
Yes, thank you, Chair Wickland and members of the working group. So Senate Council and House Research will base our walkthrough comments on a document you should have in your packets titled List of Sections Included. And since we are only focusing on policy with this walkthrough, we're going to start with Article 2, titled Department of Health Policy. Sections 1 through 3 modify the information that 340B covered entities must report to the Commissioner of Health and makes technical changes to the reporting section. Sections 4 and 5 allow uniform explanation of benefits to be made available to patients in electronic form. Sections 6 through 14 modify requirements for reporting to the Commissioner on prescription drug prices and related information. Sections 15 through 17 and 36 modify time and distance standards to providers with which health carriers offering individual or small group health plans must comply for purposes of ensuring geographic access to providers. Sections 18 through 21 modify the duties of the Commissioner of Health related to groundwater thermal exchange devices, submerged closed-loop heat exchangers, and inspecting well construction notifications. Sections 22 through 26, 34, and 35 transfer administration of the Healthy Eating Here at Home program from the Minnesota Humanities Center to the Commissioner of Health and adds Sunbucks or summer EBT benefits to the program. Sections 27 through 29 define controlling person for statutes related to hospitals and modify circumstances in which notice must be provided and when public hearings are required before a hospital closes or curtails operations. Section 30 establishes requirements that must be met for health professionals, students, and residents to perform sensitive examinations on anesthetized or unconscious patients. Sections 31 and 32 modify membership composition of and appointments to the Health Equity Advisory and Leadership Council. And Section 33 establishes qualifications that central service technicians must meet in order to provide services at a hospital or ambulatory care center. In Article 3, covering the health licensing boards, there are only 2 sections that were not already covered in the spreadsheet. That's Section 105, which establishes requirements for dentist supervision of dental therapists that are practicing under the auspices of the armed forces. And Section 122 requires the Commissioner of Management and Budget to submit a report to the legislature identifying any health-related licensing boards that have accumulated 1 year or more of operating funds. We will then jump to Article 6, titled Health Policy. Sections 1 and 2 of that article strike obsolete effective dates from sections governing accreditation of environmental laboratories. Section 3 requires the Commissioner of Health to conduct maternal death studies within the limits of available funding. Section 4 modifies requirements for collaborative agreements between physician assistants and physicians. And Sections 5 and 6 make changes to the scope of practice for optometrists and require optometrists to obtain approval from the Board of Optometry before performing permitted injections. Article 7 is titled the Minnesota Health and Education Facilities Authority, and sections 1 through 31 expand the existing, what is currently called the Higher Education Facilities Authority, to allow it to provide capital financing to nonprofit healthcare organizations. It renames the authority as the Minnesota Health and Education Facilities Authority, modifies membership, increases the cap on outstanding bonds to $5 billion, and allocates $2.25 billion of this amount for higher education projects and $2.75 billion for healthcare projects.
And now moving to the next section, please. Go ahead.
Madam Chair and members, moving to Article 10. This is at the bottom of page 7 of the summary document. This is Child Protection and Welfare Policy. Sections 1 through 7 and 27 modify definitions, licensing and training requirements, and guidelines related to child foster care provided by relative caregivers. Sections 8, 33, and 34 make changes to child welfare investigations and the appeal of agency decisions related to child maltreatment that occurred in another state. The next rather large batch of sections, sections 9 through 13, 15 through 30, 32, 35 through 38, and 40. These are from the DCYF policy bill. The child welfare provisions, including technical and clarifying changes to the Minnesota African American Family Preservation and Child Welfare Disproportionality Act. They also add inquiries into a child's heritage throughout relevant statutes and make changes related to extended foster care, case plan documentation, reestablishment of parental rights, and non-caregiver human trafficking response. Sections 14 and 39 are also from the DCYF policy bill. These are child welfare provisions related to truancy and reporting requirements for school attendance concerns. And finally, Section 31 modifies the definition of neglect for purposes of child maltreatment reporting to address situations in which continued hospital stays for children occur when the children have mental, physical, or emotional conditions and cannot return home, but for whom necessary services are not available. And that concludes Article 10.
Thank you, Ms. Sunderman. Next, we're moving to Ms. Hoffman-Litchi.
Thank you, Madam Chair. Madam Chair, members, we'll move on to Article 12. This is Early Care and Learning Policy. Section 1 makes the Diaper Distribution Grant Program a sole source grant to the Diaper Bank of Minnesota. Section 2 specifies data privacy requirements for the Great Start Compensation Support Payments Program. And then moving on to Article 14, this is the Department of Children, Youth, and Families Licensing and Certification Policy article. This is on page 10 of the summary document. Sections 1 and 22 define education for purposes of determining an individual's qualifications for working in a child care center. Sections 2 and 7 make changes related to the move to continuous licensing. Section 3 allows a child care program license holder to request interpretive guidance on a correction order. It also modifies the timelines for when the commissioner may publicly post a correction order issued to the child care program. Sections 4 and 6 direct a child care program to publicly post licensing actions accompanied by a maltreatment investigation for 4 years. Section 5 removes the prohibition on publishing documented technical assistance under the weighted risk system. Section 8 makes permanent the temporary staffing changes for child care centers that were enacted in 2023. Sections 9 and 10, 13, and 19 make changes to child passenger restraint system training requirements. Section 11 modifies training requirements for substitutes and unsupervised volunteers in child care centers. Section 12 makes technical changes to requirements for a child care center's emergency plan. Section 14 modifies training requirements for substitutes and adult caregivers in family child care settings. Sections 15 through 18 make changes to requirements that govern certified license-exempt child care centers for federal compliance purposes. Section 20 directs the commissioner to develop and implement standardized licensing timelines and standards for child care centers. Section 21 directs the commissioner to establish timeframes for county licensors to respond to requests from family child care providers, and also requires that the county licensors use the electronic licensing inspection tool when doing the inspections. Now moving ahead to the last article, Article 19. This will be on page 12 of your summary document. This is the miscellaneous article. I will just note the sections that were not already covered in the spreadsheet walkthrough. Section 7 and 9 through 12. These establish requirements for green burials and for the scattering of cremated or hydrolyzed remains in public and private cemeteries. Section 8 modifies the eligibility requirements for housing stabilization services. Section 15, it transfers to the Commissioner of Children, Youth, and Families the powers and duties from the Commissioner of Human Services that are in uncodified laws that are related to the powers and duties in statute being transferred to the Commissioner of Children, Youth, and Families and other laws. This is related to the recodification effort. This just captures any duties or authorities that were not in statute that were already part of the recodification effort. And finally, Section 16, on a biennial basis, requires the Commissioners of Health, Human Services, and Children, Youth, and Families to report information on grants administered by each agency to certain members of the legislature and certain legislative offices. Thank you, Madam Chair.
Thank you very much. Members, do you have any specific questions that you'd like to ask council before we move to more of an open member discussion? And seeing no specific questions at this time, I guess then I'd like to move to member comments and questions. And I don't have a list started, but whoever would like to be first. No? No questions? Okay, well, we can move to member comments or thoughts. Anything? Nobody? Do you have, oh, I'm sorry, Chair Cotiza-Watun.
Thank you, Madam Chair, and I just want to express my gratitude to the staff and the many members sitting at this table who have spent countless hours over the last few weeks to put together a bill that I think does overall very much good and at minimal harm to the people of the state of Minnesota. I'm really proud of the children and families provisions that Chair West and I worked with our committee members to put together, and I think that there's something in this bill that everybody can find a reason to vote yes for.
Thank you. Other members? Chair Bierman.
Thank you, Madam Chair. Thank you, everyone, for being here today and doing the walkthrough. Very informative. I just want to say, too, that I think that we did some really good work as this bill moved forward through each stage, and I think the bill has just gotten better and better. Of course, as was just mentioned, it's not everything in this bill. It never is on a healthcare bill, and there's always more work to do. So we're making a lot of really good steps that we've come to agreement, tough agreements, to reach, and just appreciate the work of the members on these working groups, because it was a diligent number of weeks where people were very focused, and we did have to come to compromises. But I'm very proud of the bill, and I think, as was just mentioned, there are things that every member can vote for. So thank you very much.
Thank you. Any other members have any thoughts you'd like to share? Oh, I'm sorry. Senator Utke is on Zoom, and I'm sorry I missed your hand up. So please, Senator Utke. You're muted, Senator Utke.
There we go. Thank you. I forgot the last piece of getting so, because of travel distance, I wasn't able to make it there in time. So I'm glad to join you via Zoom. It's just, I wanted to just touch on a few of the items that, I still have concerns on, and I'll do more of it when these things hit the floor. But some of these that are the carve-outs and the cuts that are MA benefit related, and that's, the non-emergency medical transport, dental carve-out, cutting the adult chiropractic. If I go through that list, it doesn't take much effort to get up over $200 million of so-called savings on that spreadsheet, and I just don't see how we're going to accomplish that. Just because we remove something doesn't mean the need goes away, and that's my concern. The people are going to, the cutting adult chiropractic, if it doesn't work at the chiropractor, are they going to go to the emergency room? Those type of things I think we need to look further at. I think we're going to be revisiting those down the road, and just taking a good look at how we're doing things. There's a lot of reductions in that spreadsheet, but yet I don't see any reductions to the agencies. I see an additional 76 FTEs and other things. I just have a problem with that, and like I had said on the floor back with this bill originally, transparency and accountability are number one for me, and I think vast majority of Minnesotans. And unfortunately, that wasn't the process putting this bill together. That, we all know where it all took place out of the public eye, and actually, out of my caucus's eye too. We weren't involved, and so I'll do more when it hits the floor. But I have serious concerns on the bottom line of these spreadsheets and how accurate they really are. I do believe that we're going to be, over the next year or so, seeing that we've got some major problems ahead of us because of these things. And hopefully I'm wrong, but there are concerns. But with that, I thank you for the opportunity to join remotely, and I will see you all in St. Paul tomorrow morning.
Thank you very much. Chair Backer.
Yeah, thank you, Madam Chair. You know, the things with health is kind of similar to education. The agencies do not, the agency itself does not deliver the service. So it's something that was very important to our side of the aisle is getting the services to our citizens here in Minnesota. So how we were able to do that is, which I think is a significant win, and was bipartisan agreement, is what we've done with the hospitals. Would I like to see it up to 6%? Yes, but 5.75 is better than 5.5. So the work that we did for our hospitals, and specifically Representative Nadeau, hats off to him on that, and I know a lot of people was involved with that. But without that background in our state, we would start to see hospital deserts. EMS, no surprise, that's something that's very important and dear to me, and so forth, especially we're in greater Minnesota, because we still have services that are running in a deficit. We did some good work last year. We are doing good work now, especially with the no load compensation pool and so forth, because the services don't get paid for that. So again, focusing on the services is what's important in my opinion. And then we did some stuff for pharmacy this year. So really looking at how we deliver the services, boots on the ground, is what I like the most about this bill. As Chair Bierman said, there are things that we don't like. At the end of the day, we do, I think this committee, this working group, focusing on those three areas is something that we can be proud of. So thank you.
Thank you. Chair West.
Thank you, Madam Chair. Overall, it's a lot of work, and these bills came together in a compromise manner. It's the way of the whole legislature. The few comments I'd like to make are, we have a huge child care problem in Minnesota. It's absolutely absurdly expensive. I pay $900 a week just myself, so you know where my legislative salary goes. It's brutal out there. And one thing we don't do in this is increase funding for early learning scholarships, which is unfortunate. Certainly we have budget constraints, but at least the children and families portion, we don't reprioritize basically any funding where we could put money that's being ineffective and put it towards something that would have a greater good. And given our certain situation in the budget, it's like we should have done more on that. And if the budget situation gets worse, my hope is that we can finally look at programs that don't work and put that money towards programs that do work. It's my understanding that the health policy portion of the bill did that a little bit, but the children and families portion didn't do that much at all. There are some positive reforms for childcare. There's some positive reforms for daycare safety and education of parents on abuse recognition. So we made a lot of small strides, but considering where we are and where the economic situation is likely going to get worse, we're going to have trouble making significant investments going forward. So it's very important that we reform our child care system. I mean, it's 20 grand a year for an infant in a center right now. It's untenable if we want people to be raising families. And the last thing I want to say is, I think this work group situation we're doing right now is kind of silly. We're here in front of the public after we've done everything, and I don't think anybody in the audience is somebody who isn't paid to be here. Maybe there's a few. That is not an ideal situation, and that is a bipartisan problem. That's an institutional problem, so it's not that we can shame anybody. I am certainly part of the problem in this circumstance, but we have rules about open debate, and we flagrantly ignore the spirit of those rules. Technically, we comply with them. And especially with a working group during this period, and again, we're all guilty of it up here, it's not how this business should be done. And in a tie, there was definitely no other way to do this. We saw that with the tax working group in about 5 minutes. But my hope is, going forward, people can look at this process, vomit in a trash can, and try and actually make things a little better. Specifically, things like exempting the how long a conference committee report can sit at the desk at the last few days of session. I get why we have that rule, but it's a really, like, it obscures what we do here. And I think the working group situation makes it even more egregious than our typical conference committee situation. So my hope is that all the members here, and I accept I am equally to blame, so I'm not besmirching anybody up here, we have to do better than this. Allowing like written testimony when all the decisions are made is just, it's flagrantly ignoring the rules we have in our own process, maybe not technically, but certainly the spirit of those rules. So maybe when we're not in a tie, we can ascribe to the better angels of our nature and do our work in public. Because I do feel bad for anybody who is attempting to track this who isn't a lobbyist or pays a lobbyist. They didn't learn anything from what just happened today from this little, we're going to pass this tomorrow, this little working group. And while I was sitting here, I was simmering and simmering and simmering, and then I just had to say something at this juncture. But everybody did a lot of hard work. We tortured our staff, and I really appreciate all their contributions. But we can certainly do better. And everybody knows this problem has been here for more than 5 minutes. And this isn't how government should be done, but I guess it's how government will be done today and tomorrow at the very least. Thank you, Madam Chair.
Thank you. Chair Newer or Schumacher, any comments or thoughts? Chair Newer?
Thank you, Madam Chair and chairs. We have almost 7 chairs here. Anyway, I just wanted to say thank you. I think this has been more collaborative. We've worked with many stakeholders to get to where we are. It's a difficult budget. You know, when you have a deficit, we have to look into ways that we can manage what we have. I know that it's not easy to come to the conclusion where we have reached, but there are so many good things that we have done in this bill, particularly on the side that we share with the HHS. I think there's some good things when we look at the initiatives that we're doing in the homelessness area, when we're funding the HIV/AIDS grant program, which is on a cliff right now, and several other things that we've done to address the needs for people with mental health, behavioral health needs. This is significant. Despite the challenges that we have accomplished some few good things in this bill. There are many things that I disagree with in total that are in the bill in general, but we can get there. I think we have got a significant responsibility to keep the government open and running to serve the individuals that who need the most. And I wanted to thank all the nonpartisan staff for their efforts and keeping up with us. This is not easy. They've done an amazing job, and they've helped us get to where we are. So thank you so much, Madam Chair and members.
Any other member comments? Well, I will give a few comments that I have. I really appreciate all the work and the collaboration that we've had over the past few weeks putting these different sub-target agreements together. It is a challenging process working within the constraints that we had, but I really appreciate the efforts of all of those involved and working with the chairs in the House. I think we worked hard to make the most of the targets that we were given. Each of them had to be addressed separately. We had specific guidelines for each of them from the leadership level, and so we really, I think we worked hard to meet all of those targets, and did so as well as we could. I think leadership decisions definitely influenced the bill in significant ways. And certainly, I have to say that eliminating the access to healthcare coverage for undocumented adults was not a decision that I supported. You will not find that language in this bill. It's running or going in a separate bill, but it is accounted for in our spreadsheet. And there is language in this bill that will make the Department of Health's budget contingent on passage of that proposal. That is in Article 21, Section 11. So I think that we need to be clear about what we had to include in this bill. While the Senate brought in a bill that didn't make cuts that were to public program benefits, we unfortunately couldn't maintain that goal of trying to avoid cuts to public program benefits as we brought the bill together in the health target. It's not my preference to have cuts to the chiropractic services for adults and the restrictions on occupational therapy and physical therapy, but we unfortunately had constraints that we were working under. We had to be very selective about what items that we could address, and all the while trying to include the priorities of the administration, the House, and the Senate. It's a lot to bring together and to work through. There are numerous things in the bill that I do think are addressing critical concerns for our state, and I'm pleased to see them in here, and I believe they will improve the lives of Minnesotans. I'd just like to highlight a couple of things. The rates bill that will allow the Department of Human Services to move forward with an application for a directed payment program that will address mental health rates. I am really very pleased that we are able to move forward with that. I had hoped that we would include all provider types in this proposal. That's the proposal that we brought in to the bill, but I am pleased that mental health rates are going to be addressed, because we know that our mental health continuum is not fully formed, and we need to find ways to increase rates to these providers so we can strengthen it. I'm also pleased that the hospital direct payment program bill is included, as we know that hospitals are essential and funding, providing additional funding is really important. I think the funding that we're providing to FQHCs and community clinics is substantial, and I think that is a highlight for me for the bill. Also, the areas that we're addressing pharmacy issues, I'm really pleased that we were able to include the directed payment program in the short term for community pharmacies, as well as the move to a state PBM as a longer term way to help support patients and pharmacies better. Another key provision, the formulary freeze that will allow Minnesotans to keep their needed prescriptions through the plan year, affects the people who are enrolled in our public programs and the fully insured market. And I think this is really a notable provision that will help people avoid cost increases and delays in care. And then if I just a moment touch on the children and families area, I'm really pleased that we were able to keep our funding for the addressing food insecurity at as high a level as we could, with $12 million going to address food insecurity through food banks and food shelves and prepared meals and tribal sovereignty. And then also in that area, being able to move forward with $35 million in support of the SSIS modernization project is really, I think, a tremendous achievement for us with the budget we were given. This will allow the Department of Children, Youth, and Families and Minute to be able to proceed with that project. And we know from what we heard last year and this year that it's absolutely essential that we address that system. We have over 150,000 kids in our child welfare system that need to have their concerns met, and the current system is not allowing us to do that. And Lastly, in the human services area, I am also pleased about the HIV funding. We know that there have been cuts or will be more cuts at the federal level, and providing ongoing funding at the $6.5 million level per biennium is really, I think, a really remarkable achievement for us as well. So there are a lot of really good provisions in this bill. I think there are some things that I don't care for as much, but I think that given what we had to work with, I think we've come forward with a very strong bill. And will be interested and hopeful that we get it passed tomorrow. So any other comments or questions from members? If not, that concludes our business for today, and this meeting is adjourned.